It's great to have such a good group and some familiar faces. I'm Jessica Bearman. This session is focused on evaluation of place-based initiatives, or place-conscious initiatives. And at the beginning, Bob Ross mentioned evaluation, and he said that after 4 years, they're finally beginning to figure it out, right? And thank goodness they didn't wait to figure it out, because then they would still be planning. And I think that this session really catapults nicely off of that. We're going to explore the challenges and opportunities inherent in evaluating this complex work, this place-based grant making. And in doing so, we're going to invite you to jump into this inquiry. Many of you are already deeply involved and submerged in this inquiry already. So I'm Jessica Bearman, and I come to this conversation really as a learner after 3 years of coordinating and facilitating grant makers for effective evaluations, grant makers for effective organizations, community of practice of funders who are focused on evaluating place-based grant making. I can't seem to stop having this conversation. But fortunately, I am also joined by 3 panelists who have very deep, bona fide expertise, passion, and knowledge around this issue. Tom Burns, who is the managing director of the Urban Ventures Group. David Chavis, principal and CEO of Community Science and Evaluation Firm. And Pennie Foster-Fishman, who's a professor and senior outreach fellow at Michigan State. And I encourage you to look at their bios. I'm not going to tell you anything more about them because we've got a lot to talk about. So of the many confounding aspects of place-based grant making, trying to support and catalyze meaningful, positive change in communities, I think it's fair to say that evaluation really tops the list. And we certainly heard about that this morning. We're not there. We haven't cracked the nut. We're not yet using the thinking tools and knowledge of evaluation to best inform our decisions, make adjustments, engage residents, understand implications of our work. We're just not there yet. And so this session is really going to look at evaluation in the context of this work. What is its most constructive role? How might we think about evaluation as a truly meaningful part of place-based grant making? And how can we use it to best inform our work and to make sure that we're having greatest impact? And we have 5 propositions for your consideration. We're going to take them one by one. We're going to get your contributions as well as we go. We're not going to be coy. I'll tell you what they are right away, and then we'll dive into them more deeply. So the first is that this isn't rocket science. It's harder. The second is that evaluation begins with strategy. The problem is not evaluation. The problem is actually non-adaptive strategy. The third is that learning and adaptation really must be the primary uses for evaluation. The fourth is no justice, no results. If evaluation and initiatives are not taking on those central aspects of social justice, then all other results are meaningless. And then the fifth of our propositions is that you've got to be ready. You've got to be ready. The foundation has to be ready. The grant maker has to be ready. The community has to be ready. The evaluator has to be ready. And so we're going to talk about each of these, and each of my panelists are going to take a turn kicking it off. All right. So I will eventually sit down. If folks in the back have any trouble hearing, just let us know. All right, so we're going to begin then with this first key theme. We have to embrace complexity. This isn't rocket science. It's harder than rocket science. And I'm going to ask David to kick it off, and then Tom and Pennie will chime in.
I remember that somebody in the funder in this room, so I'll be anonymous, not in this particular room, in the larger room necessarily, as we were working on discussing this and looking at the different components as they had their multiple goals and really want to transform communities and address hardcore issues and multiple systems. And they may make fun of a logic model and that theory of change because it's a level of accountability and detail that no one really wants to get into. I mean, after all, it makes you think about the relationship between what you're doing and the outcomes that you want, and that's like really hard for us to do when we have so much going on and so many calls and Twitters and tweets and emails to respond. But I always remember the conversation as I presented them. I believe that those, on one page what they had told me, and we'd worked on the details, and they looked at me and said, you're making it so complex. And I said, this is what you're doing. It is complex, and I think that's really one of the lessons. I have another part of this that I like to mention is that it's recognized outside as complex. When I was a professor at New York University and worked with psychology, was with physicists, and the physics department, psychology, were like wall-to-sleep on the same floors, and we would have lunch together in the West Village in New York, and we would order our food and together, and this lunch bunch became really famous because we really eat well, because that is really my forte, and after a couple of years, there were Nobel laureates and MacArthur Fellows there, and everybody talked about what they did with black holes and quarks and all that stuff. And said, David, you're quiet on what you do. What do you do? And I explained this. Go, wow, that's really complex. That's really hard. How do you handle that? Because after all, what we study is things that were true. The laws of physics are true 5 million years ago and 5 billion years from now. The same principles apply. It's just our matter of learning. That's static. And as I said, that's what hard science is, okay? But what we do changes in 5 years. If you think about the social rules 5 years ago and what was normal 5 years ago and what's normal now, that's change. And that's where we're chasing a moving target. And I think part of it is now, so we have to be able to understand that what we're chasing is a moving target, that it is complex, and we have to, as Lee Shore talks about, embrace that complexity. And that's the first thing, and I think that's the hardest thing for funders to accept. If we were doing heart disease, they wouldn't ask you exactly how does that prescription work, and can you show me the chemical interaction between them over time? No, they want to look, they take the summary. So we have to separate embracing complexity with our ability to communicate, and not get those two things confused. So methodologically, that means that we have to begin to use methods and approaches that do address the complexity of it, but at the same time, we have to be able to manage the ability to communicate that and enable learning through that. So I think that's really important, is that our message has to be brought forth, and I think for the funders in this room, my experience with multiple initiatives has been, we do a tremendous service by selling it simple and then getting caught up with the complexity and then blaming the community rather than our own preparedness, okay, for the idea. So I do have to throw in another theme, which is that for funders and evaluators, the challenges we face is our lack of preparation and our readiness and our capacity to be able to roll these things out, and that and not learning from the evaluations who said, long-term planning stages, for example, my favorite one. I could write the report and fill in the name. Long-term planning processes and communities don't work. They don't help. They're really debilitating. Okay, but right now, today, for I'd say probably 90% of what's being rolled out right now, or more, is being long-term planning sessions. So we have to learn the different methods in that. So that's where I'd like to, I think that's really I'd say about it, is that it's really, as Lee Shore, it was so right, and we don't listen. Embrace complexity, work with it, don't fight it, just learn how to communicate it.
We really need to ask ourselves as evaluators, how do we handle this complexity? And I think, first of all, we need to own that we don't know all the appropriate methods yet. They haven't been developed. The literature says that if you go to any article recently written that talks about how do you work in a complex problem space, it will say we don't effectively know as evaluators or researchers how to do that. They're still under development. But I think we know what not to do. And I think that's what I want to begin to highlight a little, because I think we're still repeating mistakes that evaluators have learned don't work well. And I think we can actually propagate inequities, and we can propagate the myth that this work is simple and how we approach our work. So basically, what I'm saying is we don't yet know exactly, as evaluators, how to handle that complexity, but we do know how to avoid oversimplifying it, right? And that's that sweet spot we currently have to live in, and we can continually move more towards better understanding that complexity. So let me give you some examples. I think many of us rely on population-level data. We use data points and we present them as single numbers that are then tracked as milestones or outcomes or benchmarks. Pick your word, your language, your favorite one. They are significant misrepresentations of community life because they obscure the disparities that are there. That is an excellent example of oversimplifying community life when we take single data points and we represent them as the reality. Case in point, the percent of kids who are succeeding passing a third grade reading test. All you have to do is disaggregate that data point by race, and you have a very different story. it is imperative upon us, as evaluators, to make sure that the data we collect allows us to disaggregate that story so we can understand for whom and under what conditions. And until we do that, we will, I think, to serve the communities that we work with specifically. I
said to myself, do not be cynical. Do not repeat the obvious. Then I got up this morning and said, okay, what stuck from that? Prue, I think, is in the back of the, I saw, yes. Prue, what did you name? 25 years, I believe, didn't you, this morning in your opening remarks? You beat me by a couple. I could do maybe 23 years. I'm thinking my first entry into this realm of place-based work was in the South Bronx with the Comprehensive Community Revitalization Program in '91 or so, and it was simultaneous with the Annie Casey Foundation's first entry into this work with its Rebuilding Communities initiative. And I want to start there for a minute, because I think that the seeds of what we've been saying about faulty strategy actually go back to that moment in time. And we're free of a lot of it, but I don't think we've figured out what we are replacing some of those ideas with fully. At that time, Elizabeth Shore had just done her really important piece of work around theory of change. The concept was very new, and we were eagerly saying, we are going to show how you use this wonderful new tool, theory of change, to enter this complex engagement of lots of stakeholders in places. And we are going to address all the kinds of issues that she told us were difficult and that we needed to be careful about. It was also a time when this focus on impact-oriented or results-oriented evaluation was really gaining a lot of steam. And that led us and everyone else, I think, who was really doing this work in the field to really attempt to create logic models, theories of change, frames that attempted to capture some degree of the complexity that we all know attend this kind of work. And I think that, when I think of faulty strategy, some of those efforts contributed to faulty strategy. We often spent a year, 2 years, 3 years in these planning efforts to sort of work with a funder partner or funding partners to sort of articulate these unbelievably complex models. And there were a couple other people who I know are at the event who were along for this ride with those of us who might be here now. We have not been comfortable fully shedding those frames. We still hold to this sort of the security that a kind of a richly complex model of these really open, to go back to your point, these incredibly open, fast-changing systems in contexts that are just furiously changing. We still hold to a lot of that, and I think that as evaluators, this goes to kind of the core of what we think is important to our value added within this field as partners in strategy development, in the way in which we frame what an initiative, capital I, is, what it looks like, what it intends to do, what it tries not to do. And as we go further into the conversation, I would like us to sort of, bravely look at not only what we need to shed in the way of the frames that I think are contributing to the faulty theory, but what we've got to replace it with. And that's where I would
Great.
hope we go.
Great, so you rolled us right into it starts with bad strategy as well. Terrific.
Yeah, and maybe I could just pick up at Tom's. I always had the hindsight of what I wish I said, so I'm going to grab at least one time of that. But I think Tom passes the baton in an important way. One is that how do we rethink? I think there's important things to put them in very tangibly. First, I want to know, how many people are evaluators or have evaluation responsibilities here? Okay, so I know how to kind of shoot the line here. Okay, so it's not a majority for a change. So so let me put it at this level. There's 2 points. One is how we conceptualize the issue. The real theory, what was missing, I think, in the discussion, is that we're looking at changes in systems and communities now. I think that's really the important part. And they're not synonymous. A community is a system, but it's a specific type of system and has lots of subsystems. And then there's the larger nesting of systems that they were talking about. Not just the economic, because I love the point that it's not the economy stupid, it's people and community stupid. The economy is just a central part of people's lives, but it's not the only thing. And we have to understand that if we're going to have change, there's more there. So one way is beginning to take that community systems approach to it. The section thing, and then just to make sure that the title gets mentioned, is a new view of context. Context has been portrayed in our logic model theories as static, as backdrop, as an explanatory factor. It's true, but that's 10% of what it is. Context. A colleague of mine just came back from a conference. I can't attribute this idea to it, but I think it was a really good way of expressing something short that I've been saying for a long time, is that to look at contextual mechanisms. What are the contextual mechanisms? Context is active, because the thing about place-based initiatives that's so interesting is that not only are we affected by context, but we change context in place. So we have to look at those mechanisms, those that we move and those that we don't move, and how they affect the outcome. The other part I want to make is this whole notion, I want to put it on the table, is about rigor and the so-called gold standard, or the old standard, okay? That it's going to take, for those of us who are consumers of evaluation or producers of it and research on it, we have to kind of realize that was based on, rigor can mean 2 things. It can mean either rigid, which is how it's being applied, or what it really was meant was principled. And so those scientific principles can be applied to place-based initiatives they're not all there, they need to be developed, but they have the potential of being developed because there are principles that can be done with a little bit more thought rather than just a formulaic approach that experimental designs offer in those contexts. Okay, so there are things to begin to work with. I think Pennie's work on taking systems with the enable model and her approach to that is one way of looking at systems. There are other tools out there that also I think have a lot of promise. We use cross-case study methodology a lot, which is still as rigorous as that, but appropriate to the diversity and takes context into factor. Systems and outcome mapping are also very important tools, and they can be used that way. It's beginning to do that. So there are things out there. I just want to make sure that in Tom's spirit of not being those old cynical guys up here and young women, that we're not just saying, throw it out. There is stuff, there has been progress to it, and it's now mainstreaming that and not being apologetic that we're doing these other things. That, it's not, this is sad, just like we do anything else. We're holding up something that's antiquated and inappropriate and then trying to play that game. It's the scientific principles, that's what rigor is, and I think that's really how we begin to address complexity in a nuts and bolts fashion.
So what do we know about complexity, and what does it mean to be evaluating it, right? What we know is that we have to be adaptive, we have to be flexible, and we have to be creating learning systems. That's what we know. And those are all things that evaluators do. I think what has unfortunately happened is because of the press for accountability and the movement of evidence-based practices, what has happened to evaluation practice in a lot of place-based work that I've seen around the country is it has de-emphasized flexibility in learning and overemphasized accountability. And I think there's a risk at that because there's now become such a focus on discrete, observable outcomes that we forget how we misrepresent the work when we do that, and how a sole focus on accountability actually misses the value and the contribution that evaluation can bring to the table. So I actually think as evaluators, our role in this complexity is an ethical imperative. in my opinion. I think we have an ethical imperative to help shift the narrative about what the purpose of evaluation is in this complex space. We know this, we live it, we see it, and we must bring that different perspective into these conversations, particularly in the light of day when foundations themselves, because of their trustees and the larger sort of public will around accountability that has emerged, they're feeling significant pressure to have solely an outcomes focus, which I think it jeopardizes the value of the work and actually puts a lot of blame on communities when they're not succeeding. And so for me, that's where we live at inside this complexity is for me primarily an ethical perspective and keeping the focus on learning and adaptation. And you can live in the world where you are also simultaneously tracking outcomes, but it is the narrative and the story around those outcomes that matters, as well as the kinds of outcomes that you track. And so there was a recent review that was done. 70% of community change initiatives that are all focused on complex stuff, 70% only assessed individual level outcomes. Okay? That's us, guys. We're all the evaluators in the room say me, okay? That's us. And so we are the ones that can shift that by ensuring that our models, our theories of change, our outcome measurements, whatever kind of data we're collecting is also assessing place. What are these called? Place initiatives. Our evaluation should lead with an assessment of place. And so we have to become skilled in understanding what does it mean when we come into this conversation? What does it mean to be assessing place? There are lots of great theoretical frameworks out there we can draw from the organizational change field, to the community change field, to the systems change field, that we can bring into our work to help us identify what do we mean when we are assessing place. But if in your evaluation model, at the end of the day, you are not, A, disaggregating outcomes, and B, only assessing individual level outcomes, then you are actually not contributing to the transformation of place.
Okay.
I would just add that I think one of the advantages of this shift that has occurred over the last couple decades in evaluation, which is allowing the evaluation role to be more of an inside and outside role, away from that kind of neutral, objective, at arm's length, data-heavy frame, and toward one in which the idea of learning and engagement with the sponsor or the initiative designers early enough to have some effect on the quality of the strategy is a huge thing that we should be celebrating. Mm-hmm. It is a major movement, I think, forward for us, and an opportunity. I think we just aren't good at taking that opportunity yet, but I think it's something that has really shifted now. Mm-hmm. And I think we as evaluators struggle with role definition, given training, professional positions, and so on, with balancing all the things we learn, the kind of technical language that we hold on to, data gathering, as opposed to simpler observation, sense-making, interpreting, the softer language that helps us really contribute to learning in a context. We still look at our language. It's still very caught up in things that don't actually apply to the kind of complexity that we are having an opportunity to be in the middle of.
David, did you have a comment?
Yes, I do. You know that I do. And so following, no, actually, no, I don't. I would raise one quick point, and that is that I think that, to go back to Doug's question of the challenge, I think we have to apply that systems approach, environmental approach, to ourselves, which means there's at least very simply two parts to that. One is we have to be prepared and ready for that, because it's a very sacred, I can't think of a good word, but a very highly responsible. You're dealing with data in people's lives. That's what we're really dealing with. So we have to make sure we know our stuff, or whatever way you want to say that. We really have to do. And that means also changes our skills, which means we do training of our staff in facilitation. That's a required thing, and group process and consultation skills. Not how to be the talking head, but how to really facilitate learning. So we have to build our skills. But the flip side is more important, which is the culture of philanthropy and government and decision-making has to change in order for us to have this role. It's slowly changing, but not enough. We went from the day that the evaluators to be seen and not heard. It's just the data. But the thing is now the culture that do you make decisions as foundation people based on knowledge? We need to be able to be knowledgeable of what's out there in the literature and communicate it process and help you learn, but you have to make your decisions then based on that learning, not saying, yeah, I know that's what we learned, but I read this brochure that came by yesterday and it sounds really good, and I went to the Council of Foundations and this was this great thing that everybody so we're doing this now. Or I know, I wish I had this conversation last week, but we already decided. So I think that is really critical to be.
Right.
We have to put that on the table, that it's like anything, we're all interrelated. There is that butterfly principle here, but it's very cause and effect. If the culture isn't there and we're not ready for it, it's not going to happen as well, even with this opportunity.
Mm-hmm. So we've been talking about the evaluator's role sort of as a player within this complex system, and also a little bit about sort of how evaluation can inform strategy best, right? So it's not distinct from, it's not after, it is part of. But I want to pose to the panel a sort of question that links these two, which is then what does it look like when evaluation is used appropriately to inform strategy rather than being an afterthought, a punitive sort of accountability measure? What does it look like in its best case? And perhaps you have real life examples, and perhaps you have an aggregate, but give us something concrete, if you can.
Yeah, so some work that I actually did many years ago with the Kellogg Foundation that I think was an excellent example of the partnership between evaluation and design. It was the very beginning of their planning of their, this was what place-based initiatives, formerly known as comprehensive community initiatives, right? Okay, this was back in the CCI era. And what the program officers asked us to do is, well, they were in the process of planning, and they were, as David mentioned, going around to lots of conferences trying to understand how do you transform urban poverty and educational conditions. How do you do that? And in every planning meeting we met with them every 2 weeks. They had some ideas that just from the next and last conference that they went to. And so we suggested, why don't we instead go out into the community and find out what the community thinks needs to happen and be prioritized? And I have to say, that was a risk. That was not the foundation way for them to do this. And yet they were very open because they knew there was lots at risk for not succeeding with this work. So we went out into the community and talked to hundreds of residents in all kinds of ways. We did a photo voice project, we held community conversations, town hall meetings. And lo and behold, what the residents said they needed was not what was on any list that came from any conference. Very similar to the California endowment story, to be honest with you. And so the foundation was highly responsive to that, and for the first 3 years of this effort, designed its Yes We Can around what the residents said they needed to really get ready for the next phase of the work, with the second phase being more aligned with what the foundation thought it was going to do. And so for me, that is to me what this kind of partnership can look like. When you are using that authentic resident perspective to help inform the strategy, understanding the local root causes of the processes. I mean, I think that, if you think about complexity from a system science perspective, there are a couple of key principles that you can keep in mind as an evaluator. One is you have to engage diverse perspectives to understand the problem or the system, right? So you don't go forth on anything until you understand the local reality, and that includes making sure you talk to the very constituents that are going to be targeted by this effort, okay? That sounds simple enough, but I'm surprised by the number of initiatives that get launched where there was never an actual resident spoken to about their needs and their aspirations and their experiences. I just trained about half the state leaders in a particular problem space. I will not name what that problem space was. And I asked the hundreds of people in the room, all state leaders, all making funding decisions, how many of you, before you launched your last state initiative, actually talked to a family member in your state? Not one person raised their hand. Okay? They don't have time. And program officers often don't have time either, okay? That's our job, to bring that need and that information to the table. That's problem number one. And then problem number two is that in those conversations, what you're trying to identify when you go out into the community is not just what the current conditions are, but what are the underlying root causes of the problems that exist. There is significantly often a misalignment between the strategies that are rolled out and the actual underlying causes of the problems in the community, okay? And so taking the time to understand that fit between strategy and root causes is critical. A favorite of mine are the millions of dollars spent on putting books in people's homes because there's low literacy levels of kids. The kids aren't entering school ready to read, ready to learn. And so lots of communities across America, funders, have put books in those children's homes with the assumption that if they just had books, it was the lack of access to books that was causing the problem, not realizing that in a lot of those communities, they have also low adult literacy levels too. Many of those books go unopened, okay? And so that's a great example of not understanding the root causes contributing to the fact that the child is also not able to read. So that's another piece that we can, as evaluators, be paying attention to.
Tom?
I like this one. No, please.
I'm thinking about, okay, what haven't we put on the table here? I think that the
baby, the backwater.
the opportunity that comes to evaluators who are invited in early by a funder that is sort of, let's say, ready, and we'll take that apart later. I think is to confront the dynamics that are evident within the philanthropic sector around the need to simplify, to articulate a result, even if you have some doubts, to be kind, about the potential for achieving that result, and to sort of find a path through that early complexity around sort of naming the problem and the important context pieces around that problem in a way that can communicate to trustees, to media around the funder, and so on, enough so that the tendency to either blame strategy was great, execution was crappy, executors were crappy, evaluators were crappy, and then if all else fails, and the community didn't stop. I mean, to really sort of engage from an inside role in the kind of early learning that sharpens the strategy and calibrates expectations a little bit more carefully. I mean, there are expectations about, so how much money are you really putting into this enormously complex and open system, and what are you expecting will result from that. So there's the investment level, or the complexity of the investment, the adjacent investments, or the adjacent events that are occurring at the same time, all the other context things that we know. I mean, sort of finding a way to be constructive in helping an eager and committed funder or set of funders to sort of acknowledge and adjust their own expectations and intent early enough in the strategy so that you're not writing that 3-year out report that said, well, we just didn't get to what you thought you would do. I think is a huge opportunity, and I think we're still struggling as evaluators with sort of stepping into that role with comfort and confidence, and maybe saying no to the situations where we can't help, that there isn't an appropriate role for evaluation if the readiness stuff isn't.
Yeah, I'm seeing some nods around this idea of evaluators, the potential as sort of truth tellers or expectation setters, and yet I think as evaluators, we often fail to even be honest with ourselves, let alone our clients. David?
Yeah. Thanks. And I wanted to raise a couple points. One is that going through your litany of who we're going to point the finger at in the end when the report. It's also the board. And then we say, well, we were into it, but the board wasn't. And that's another aspect of it. Or Congress was. We work with a lot of federal governments. And I think there's a couple of things that practical things that I've seen. One is I just wanted to say that I had the benefit of coming in as the implementer of the CCI after Pennie's work, and having and being an evaluator and being evaluated is a life growth experience. As Pennie and I know, we still talk after all these years, but it is like a physician being a patient. It was incredible growth. Unfortunately, having a great evaluator made it easier. But I think that was one thing that I wanted to say, that having evaluation early, not being like, okay, and here's what happens. First you make the grants, then you may be hiring the evaluator a couple of months later, but then, and the part that we're missing is the intermediary, and that's not on the table today, and that's such a critical thing, because it's all about capacity. My first answer, and what's missing is how do you build capacity, because that's really the outcome. Because that, whether you sell with the board, we have to communicate that. And the board blame thing is that we're not doing a good job. So I've seen in a recent client, I don't know when to mention foundation names or not, but I'll just say in a recent large foundation I'm working with there's a lot of place-based, they're really doing better education of the boards. Okay, about these things. And they're taking the time to do it. It's not that 2 presentations. They're really doing a lot of work on that to educate them about the complexities to make those decisions. They're making an investment. The second thing that they're doing, we work with the Casey Foundation. I can mention that because there's a report that we did on emerging principles where before they launched the next generation, they spent almost a year bringing in people, talking with their staff and building staff capacity, synthesizing what they were learning, and coming up with some principles that would help them design their next one, the next initiative. I think that's another tangible thing. The third thing, and I think in many important parts of it is very important, is to be able to build the let's go to the other one. One is, then again, is also in learning how to communicate that information. It was very important in that. I'm sorry, so I'm going to say rewards. Another foundation we're working with is changing the rewards for their staff and program officers. That's not really talked about. And Bob Ross talked about, and I was there at that time, so I could speak to the turmoil and the angst that they went through. We evaluated their planning phase. But changing the role in a positive way, it's not about laying off program officers. It's really about making the job manageable and geared towards support of this. And so the reward system changing from doing something different because nobody did it. That's what was innovation in foundations. It doesn't matter if it works, but no one did it. It's a new idea. Sounds good. That's innovation. To things that, what did you learn? Like, how do you know this is going to work? It was innovation based on research and knowledge that we invested on, and being rewarded as a program officer for using knowledge in your decision making rather than being different than everybody else, I think was an important shift. And lastly, I just wanted to go back to the point about communication. I think it's, again, being able to learn how to communicate and value the knowledge, I think is really critical for the things there. And I think there are different ways of doing that. But again, it's whether the board, staff, and then focusing on the intermediary. I don't want to lose that in this conversation. And that's about community capacity building. That is really the critical outcome in this. And you're not going to satisfy a board, or Congress in 2 years with massive population changes. But the fact is that we know from the science, and that means going beyond. Very rarely do we ever go to science in the research literature and proposing these things. The science tells us that certain capacities and certain policy changes have been proven to make a difference. So if you can get to that point, you're going to have the results. You should be working towards those critical points, those levers of change, those critical points in there.
So I'm going to shift us just a little toward talking a little bit more specifically about evaluation for learning and adaptation. Because if, as David says, and we all, I think, agree that the timeline for meaningful systems change and population change is generally much longer than the board might have appetite for, then how do you use evaluation to be sort of demonstrating and documenting and learning in the short term to make good decisions, but also satisfy that hunger for seeing progress and movement? Pennie's going to kick us off with this one.
That's right, I am.
Yeah.
So I want to talk about a couple of things. First, I think, what does it mean to be focusing on learning and adaptation as an evaluator? think about the typical life cycle of our work. It's a 3-year grant. We have an evaluation. The grant goes off. We collect our data. When do we submit our final report? If you're like me, honestly, a couple of months after that funding ended. If at that point in time I'm telling them, hey, it didn't work, I just contributed them to wasting a lot of money and people's time. And so that evaluation model has to shift, particularly within this kind of complexity. And so what does it look like and how can it be different? And I think we need to think about learning and adaptation on 3 levels. It has to happen in how we do our practice as evaluators. It has to happen in the communities that we're working in. And it also has to happen inside the foundations. And I think too often, particularly if we're hired to be the initiative evaluator, all of the learning is targeted primarily for the funder, okay? When in reality, the community, in order for place to transform, must be the primary beneficiary of that learning. And so we have to almost invert the pyramid in the ways, and almost the kind of contract that we develop with our funders, and make sure that what we're setting up is a space and a process so that the evaluation data and the evaluation process is primarily benefiting the community, and that the funder, frankly, should be a secondary beneficiary of that work. Okay, so for the funders in the room, my apologies. But I do think that the place isn't going to transform unless the community becomes part of that learning process. And so how do we do that? We have to create learning structures in communities, okay? And we have to do that in a couple of ways. First of all, I think that if you're doing an initiative evaluation of a place project, and all you're doing is collecting and using data that comes from a bunch of program reports that come in, then tell the funder, I can tell you right now what we can find out. Okay, that's not how learning happens. You're not going to have the data you need in order to assess if place has been transformed, if as an evaluator, all you're doing is taking the project reports from a bunch of disaggregated, siloed programs, right? So hopefully you're able to get and collect your own kind of data, and we can talk in a bit about some innovative ways to collect that. But most importantly, you want to be thinking about how can you create a learning space in the community. And there are now lots of models that are popping up that I think are really starting to transform the role evaluators can play in communities and how we can engage communities in learning. And I want to describe what that can look like. And so how does learning happen? Learning requires taking information and transforming it into knowledge, okay? That requires an interactive process. So how do you make learning happen? You have people coming together in spaces that promote that learning. And so the collective impact model, if you look at their structure, that's one way to do this, in which you're creating different groups of stakeholders coming together on a regular basis, in which the primary purpose of those meetings is real-time action and learning. The challenge with evaluation is we have taught local communities that we are the purveyors and the creators of knowledge. In order to transform space and place, we actually have to help them see that they are actually the creators of local knowledge, and that it is our job to facilitate their use of that knowledge in good ways. Evaluation data does not just have to be information we collect, but actors in community systems collect data daily about what is working and what is not working. And so those spaces you create in communities around learning become places where they bring in that day-to-day knowledge to talk about. And it can be organized around the outcomes for the initiative. It can be organized around place conditions, that conversation. And you simply have stakeholders come together and answer simple questions such as, how's it going getting your clients access to the services that they need? And imagine now you have sitting at the table all the providers who are touching vulnerable families related to your place initiative in that community. I promise you, you ask that simple question, you're going to have more data than you need to fill out your evaluation report, okay? And it's not just about gathering that data, but it's about then pausing them and asking them, why is it hard to get access to the services that your families need? And then third, what can we do about it? And so it is not just, remember, learning is data transformed into knowledge, and then I didn't tell you the last step, which is the most important one, turned into action, okay? And so it's then them and empowering them to say, okay, if those are the problems, what can you do to help solve that problem? And the work we do in the communities around this is we have a leader table, the top CEOs and community leaders. They're talking about these questions and issues. We have a direct providers table. We might have a program administrators table. We have a family table, and we have a youth table. And they are all engaging around a shared agenda that is focused on learning around the place outcomes. And so the agenda is very simply set. If this is a place that's focused on helping families who are vulnerable get jobs, then that's on the agenda. And every time when we meet, that's what we're talking about. How's it going? Where are you at? What challenges are you facing? What other needs are you seeing that we need to be addressing? And what we've discovered is that in real time, people start to adapt their practices and the initiative starts to transform in response to what the community needs. What I always say about communities and systems, they are the gift that keeps on giving, okay? And that is one of the truths about complexity science, right? The minute we shift A, the rest of the system is going to respond in some way. Sometimes that response is in the direction we want it to be. More often it is not, because systems don't like change, right? So more often you're going to encounter resistance or things that aren't working, like policies and procedures. And so you need to be creating and using your evaluation tools as a way to empower the local community to discover an understanding of their own local system, a gathering of local data to understand it and then act upon it. And now if you were in attendance in those meetings, or even if you just get the meeting minutes, you now also have evaluation data that you can report back to the funders, such as last month, X number of policies were shifted in X number of organizations to improve access to services. Okay. One of the great myths about place-based work is that systems take a long time to change. Actually, people take longer. Systems are really pretty simple, okay, to shift. And so it's helping people see that you can really simply shift practices and policies inside local community systems, and that's the kinds of long-term sustainable conditions that if you get into place, you actually lead to the longer-term outcomes that you want.
I think to take it to the next step of everything say is that, and then to have it sustainable and at scale. Okay, so if I'm sitting in front of funders, I'm going to ask, the real question is, where should you put your money? Okay, and the money should be in the infrastructure to do this on an ongoing basis, because it's about taking the knowledge, transforming it into, taking the information, transforming it into knowledge, and then bringing it to action, and then supporting it through that process and continuing that cycle of learning. That's not an afternoon or a weekend. That's an ongoing process for the duration as you take in new language. It's not flying somebody in to facilitate that for you. It's about setting up that infrastructure of learning and capacity building in your communities so that this is going to last. It's sustainable. It's not going to be something going with that, because that really is it, because it is complex. This learning and adaptive system, okay, needs to be what you leave behind and can be left behind and affordable. That endures. Because those of us on the other end of funding know you're into health, you're into economics. We're going to take the money and figure out how to make it work for our community. Okay? The real issue is that how do we keep on learning that process, or is it just jumping from funding to funding and whatever you have to tell us this week? So I think it's really important to take the content of what's in it and think about that infrastructure, what's in place. It's not just for one neighborhood, it has to be for all the neighborhoods in a city for that learning to happen. And I think investing in that kind of system is a really critical next step for this work. And the role of the intermediary, whether it be a single organization or network, is really something we don't put enough attention to in both studying and understanding, okay, how that works best, how do we build community capacity, not individual, but organizational and community capacity. What does it take to do that in the kind of method that Pennie was just talking about?
Agreed. This is the direction, right? So, I'm interested. I mentioned the word we have to shed things as evaluators and as funders of evaluations. So what's in the discard pile? One thing for sure needs to be in the discard pile would be these sort of annual or worse every 3-year evaluation reports that cost $1 gazillion to produce, that use data that's hopelessly obsolete, and tell you things that you can't use because it all happened. So we know that has to be set aside. I think that if we take the idea that the evaluator role can be a kind of mediator with all of the kind of neutrality and judgment that come from having a little bit of distance, in the best sense of the word, that an evaluator can bring to the situation, and allow evaluators, in the way in which they structure their role, to be sort of safe, credible, neutral mediators in these real-time learning situations, that is worth a very significant investment on the part of a funder to be able to do it. And the thing we often don't talk about in large, well-funded, place-based initiatives is the power imbalance between the funder, who's got a really clear idea about what the strategy is and ought to be, and a community who quietly says, no, probably that's not quite right for any number of reasons. I think evaluators can use that neutrality and that distance to be more effective mediators in a variety of real-time situations, and create pathways for gathering and conveying information, not data in the formal sense, but information that is highly usable for course correcting. And I think finding the ways to sort of put that up front on the table is a really important part of this next wave of evaluation thinking. So it's data of a sort, but it's all about this real-time feedback that can be heard and used, and that can be made safe to share in situations that are power imbalanced.
So I have another discard wish. So this is to all the funders in the room. So I've worked with a lot of funders of all scales, and it is very common in large place-based efforts to fund all of the grantees a little teeny tiny bit to do their own evaluation. So I don't know if you've had the pleasure of reading a bunch of evaluation reports, all of which were funded by only $7,000 or $10,000, but I will tell you they don't add up to much. And so I think we need a different model for how to fund grantee level evaluations inside a place-based effort. So for example, instead of giving every grantee a little bit of money, what if instead you pulled those resources and identified some strategy-based or outcome-based evaluators? So now all the grantees who are focused on promoting early learning experiences for kids, they shared the same evaluator, they had the same set of shared outcomes, they used the same methodology. Now we have an evaluation design that's promoted to focus on place outcomes, not individual grantee outcomes. And what the grantees are reporting on is their learning and their adaptation. They're not giving you the outcomes on their 25 people that they served. And so that's the other benefit of that model, is now you have enough people in a sample where you can actually disaggregate outcomes by race. If I only have 25 in my sample, I don't have a large enough subsample population to look at racial disparities.
Talked about sort of rapid feedback loops, evaluation for learning and adaptation, and the evaluator as the sort of mediator to raise up issues of social justice, to give voice at times to a quieter voice in the community that might be silenced by power imbalance or the presence of giant funding. And so I want to use that to sort of segue into this fourth point of ours, which is no justice, no results, which David's going to kick off. What I'd like to do is cover our last 2 points in the next 10 minutes so that we do have a little bit of time to hear from you, because there's so much expertise in this room as well. And it would be too big a panel if we were all up here.
The issue is that, as he found, that we're dealing with disenfranchised communities, that we have to deal with the power disparities and all these words, that we understand the context of it. Bob talked about it as the social determinants of health. Racism and different forms of systematic oppression are factors in our lives, no matter what Fox News says. The facts speak for themselves across the board in almost every area, and there are other groups. We're just not about race. It has to deal with also culture, immigration, has people with men, women, and young men of color. There's a lot of that stuff out there, adding to the complexity of the situation, but nonetheless true. And I think that so the evaluation point is a twofold point for me. One is that we have to begin to think of an equity-based model of evaluation. And from everybody has their view of it. It's different than equality or just looking at it. It's looking at again, it's the system, as I think the report talks about, communities of opportunity-based, but it's really equity-based evaluation. And equity approaches look at the fact that that everybody can reach their highest potential, regardless of who they're born to or where they're born. Okay? And so that those barriers are gone. And so while everybody, many of our studies, what we often see is just a group rising, everyone rises together, and we say, okay, when we disaggregate, I know Pennie's going to go into in detail, you can look at it differently and begin to see that while everybody's going, some groups are not going as quick as others. That the opportunity structure hasn't changed for people. And that's, again, why looking at the system and the outcomes of that are really important evaluative aspects of it. But also it means about beginning to understand what the effects of power are, okay? And that's a very important thing to begin to look at. But it's also for foundations that I think it's, again, speaking to that, is how do you deal with the conflict of that? It's not a data problem. Again, it's one of those things that's about strategy and what you're willing to do. It goes back, circles around. Because if you're going to take on the issues of justice, which are social determinants, the inequities that exist in systems, then you're going to get into conflictual situations. And I wish Bob talked more about how do you navigate that? How do you get that to happen? Because foundations inherently, I'm telling you, are risk averse, especially community foundations and local foundations have an additional challenge when you're trying to raise money, and groups do too. And so I think that's the dealing with differences in power and evaluation, that information is power. That's something that evaluators do have access to. So I think Pennie's point is exquisite on that issue, that we have to balance that. But we also have to be prepared to support those efforts by bringing data that will lead change, because data that we find as evaluators can be used to change conditions as well. Mm-hmm. So I think and then again, I want to, and then we have to be able to speak truth to power, which is that we have to be able to present those opportunities, those inopportunities and the disadvantages to people, onto the public, and learning how to do that. So it's going to be my last point for the day, because I'm not going to say on the other issues. But I think we really have not embraced the rest of the world on this. And I started with that, and I just want to make that point, is that right now, again, on this issue of justice, we have to bring this data to the public. It is still a matter of us talking to each other, funders, government people, evaluators, and TA providers, and the poor and disenfranchised are the audience for this. They're the only one in our system right now, and that's why it's such an uphill battle. And until we begin to expand out and begin to think about how to embrace these other communities and everybody else, as Peter Dry said so clearly, we are segregated. We have to bring those super rich people into it. There is sentiment out there, but they don't get this data. So it's not only a matter of, in addition to all the learning that Pennie was talking about and Tom, it's that the public has to learn with us too. And I think that's I think that has a big part of how we begin to get the results that we're looking for.
And a recent project that I have in partnership with an organization called the BC Pulse, which is a backbone organization funded by the Kellogg Foundation in Battle Creek, Michigan. We are their strategic partner. And it became very clear to us that while there were lots of disparities that everybody knew existed in Battle Creek, we did not have the data to substantiate that, to help people really move to action. And while we knew that there were lots of community conditions that were affecting vulnerable families, we didn't know exactly how those vulnerable families experienced those conditions and what that meant. And so we designed and created something that we called the Pulse Survey. And it was in response to the fact that there was nothing in the community that provided substantial data on vulnerable families. And so we worked in partnership with 14 organizations that represented the key health, economic, and educational sectors in the community that worked with vulnerable families. And with those 14 organizations and the consortium of 6 funders in that community, we identified a model that said, here are the key community conditions in this community that are affecting families' lives. And we are hoping that if we shift those, these are the early successes in education, economics, and health we'll see in children and families. And over time, that should lead to the population level outcomes that they want. Pretty simple conceptual model, right? And we designed a survey in which, and this is, I think, what we were most proud of, is that all 14 sites agreed and signed off on a set of shared outcomes across all 3 goal areas. So even if I was a health site, I agreed to collect data on education and economic conditions and outcomes as well. And across those 14 sites, we collected data from 574 families living below poverty. And we worked very hard to use census and public health data to make sure that our sample was representative so that the funders and the local community could buy it. And we oversampled around all the key areas of disparity that we thought might happen, so we would have sufficient sample sizes. So every single variable was assessed looking at any kind of disparity that would happen in the intersection of those disparities. We then revealed that data in a large community sense-making session, in which everybody got the full data book, but the data book was organized by goal area, and people sat at tables related to the goal area they cared the most about. And they went through that data through processes trained by us and identified what were the disparities that were of the most concern to them. Note, our focus was on the disparities, right? And what was most astounding to us was the number of disparities that were revealed in this data analysis, and the degree to which most of the people in this community had never seen or thought that these were the kinds of disparities that existed. And so we had the hospital system identifying significant ways it needed to shift its breastfeeding practices. Okay, we identified all the kinds of ways that the early childhood system was failing teenage moms. And so I highly encourage you to be thinking creatively about how you collect this kind of data. And note, we didn't collect the data, the community did. We developed the survey. It was collected by the sites. All we did was enter it and analyze it. And you can go online to our website to see all the tools we're creating for the community to begin to use this data. We've done for 2 months of use and we're rolling that out. But I think we have to be thinking outside the box about how do we collect the kind of data. We would all love to do door-to-door surveys. They're too expensive, right? And so we were looking for other ways to get the kind of population level data we needed to inform action and also to assess disparities.
So what does it mean to be ready to do a different kind of work, to use evaluation and evaluative thinking in a different way? What does it mean to be ready as a funder? Tom's going to kick us off with a few thoughts. What does it mean to be ready as an evaluator? And then we'd certainly like to get your feedback and input into that as well. So Tom, why don't you start off with what does it mean to be ready as a funder?
A really brief thing. I would say a lot of the readiness is all the stuff we've mentioned. But I want to put something on a discard pile. Again, I like this idea right now.
Maybe the theme.
Yeah, it's my theme. I think that for a funder to be ready to do this new kind of place-based investing, a very big thing needs to be put on the discard pile. And I don't think I've said this to myself before. I think a funder needs to get over the idea that a place-based initiative is a good way to achieve a population-based result. And just say it. There are wonderful reasons for supporting place-based work. They illustrate the issues that we're trying to do. They help focus and align resources around efforts that would, with other efforts, achieve place-based results. But I think that this notion that we've labored under for now a couple of decades, that the place-based frame is the way to achieve it's the gold standard version in one form or another. I think letting that go opens up so many other wonderful ways of thinking about the value of place-based work. as a part of a to use Elwood's word, the nested approach. It has an absolutely critical, legitimate role in a more complex set of strategies. But I think that this dance we do to keep trying to come back to being smarter about achieving these population-based results through the place-based strategy is itself part of the problem. So I say discard pile. That's how I would.
So you're ready when you've discarded that expectation.
Yeah, but I think that and being comfortable as a funder and in your communications and in your presenting of what you're doing and in your negotiations with trustees and others to be clearer about what you will attempt to achieve. It doesn't mean you are less rigorous. It doesn't mean you're giving up all the other aspects of what you want to retain in the way you do place-based work, but let this notion go, I think would be wonderfully freeing. So.
Other things from the audience, perhaps, that you found that you had to let go of in order to be more ready?
I'm a practitioner, but I just really want to speak to that because I'm the CEO, my name is Marianne Haverhill, I'm the CEO of MEND, Meet Each Need with Dignity. We're a multi-service poverty relief agency in Pacoima, the northeast part of the San Fernando Valley, which if you're out around the area, that's thought to be kind of an enclave of upper middle class folks, but actually Pacoima is one of the poorest neighborhoods in Los Angeles. And I've worked there for 27 years. And our agency has always been strongly involved in collaborating with other nonprofits, governmental agencies, everybody in town. We're working together. And several collaborative efforts over the years to sort of wrap around services. Once it was around welfare recipients, now it's promised neighborhoods. And I think all that's great. But we're an immigrant community, and it really speaks to something Marjorie Turner said, in that Pacoima is kind of like a starting place for a lot of very poor people. And once they move on, they just move out of the area and we don't know. And so I've been there a long time. The reality is that for all the work that's been done and lots of philanthropic money invested and government money invested, the poverty rate is probably still about the same as when it started.
Yeah.
Now, and again, my board member here says it's worse. and yet there's been a lot of improvements in the community. And to speak to your point about learning, you know, there's lots more after-school programs. There's much more access to health care. There's been a lot of trees planted, environmental improvements. There have been, the crime rate is lower. Lots of other things that impact poverty and actually improve the lives of people who live there. But the actual poverty rate has not changed. And so, in a place-based initiative, it's kind of a reality of where we are.
Yeah.
And as an agency, it's difficult sometimes to prove to a funder.
Right.
You know, we can show, in our case, we can show that adults are improving their language learning through our ESL program, or they're improving their health care through our dental and medical programs, because we do a lot of education. We can show that. But have we moved them out of poverty? Well, by the time they move out of poverty, they move out of our areas.
That's right.
We don't know. And they change phones, and we have no idea. So it's really a challenge in terms of those big numbers, the really moving the needle in terms of getting people out of poverty.
So it comes down to those expectations and what is the metric that you're gauging your success by.
Just on that point.
Yeah.
But what a good story you've just told about the role that community plays within a larger region as a place through which people move in order to sort of better themselves and their families. And shouldn't evaluators be helping you to do that?
So I think we have time for one more comment, and then just to preview, I'm gonna ask the panelists to finish then with a few words on what it means to be ready as an evaluator and what you might be looking for in your evaluators. So unfortunately, we are out of time, and so I want to close though with this final question for the panelists, and then we'll all be, I think, released to lunch. And the question then is our final comment, not just readiness within the foundation to sort of think about evaluation and place-based work differently, but also readiness in the evaluator that you select or the way that you approach evaluation as an evaluator. So we'll go out on that note, starting with Pennie. What is required?
So I'll list one, and maybe we'll go down the list. We'll share. So I actually think evaluators need to be incredibly familiar with how change happens. I think you can be an excellent evaluator and trained in an evaluation and even have your degree in evaluation and never have taken a class on change. But we are evaluating change. That's what we do. So I think it's imperative that we engage in understanding how change happens, what change looks like, how you measure change.
Great.
David.
Yes, I was thinking the same way about that, so I will
Curious.
take the next left, which is that not only so you pick an because I'm going to respond to Tom's point this way, is that evaluators, a good evaluator will know what change is possible at the population level at the in places. I think it's way too mature to shed it, Tom. I would disagree with you. There's too much scientific evidence to show that place does matter. It's just that they move to another place, so you need something there. It's not, but the single place model is bad, and that's what you're using. You go into one little pocket and then expecting to change it. That's the problem. The nesting, all places should work for everybody. They're going to move to that other neighborhood, they're still going to have problems. Okay, so and they still have to be able to grow and be supported. So I think evaluator can help you strategize what's appropriate at what level of change, and understanding that process, how to go about it, and as you said earlier, an adaptive and flexible way is really important. Anything that's rigid is not going to work for you and set in stone. You have to be able to adapt. So it's not only to know what place can do and know how to work in a place kind of thing, and understanding it as a system and as a community nested and interdependent with other communities.
Great. And Tom?
My thought would be, other than walking the talk that we've sort of been introducing in this conversation, would be to accept that a skill that evaluators need to have that is not likely to be a skill that is learned in the typical career line into this world of evaluation, has a lot to do with this facilitation narration skill, to understand, for the examples we've just talked about, these stories, and to sort of do the work of evaluation in the context of understanding the stories of the places. Bob Ross mentioned it in a way this morning around no facts without a story.
No
That's,
story
I
without
think
a
it's
fact.
that.
Sort of
I
the
think
data
it's
without
putting
something.
that in there and being comfortable with the evaluator role, including that facilitative communication skill set in the context of this real-time thing, feels like where I think we have work to do.
Great. And on that note, I do believe we have come to the end of our time. I want to thank all of you for joining us and at least starting this conversation. And thank you to these terrific panelists. Enjoy the rest of the forum.
Thank you.